This week is National Eating Disorder Awareness Week, and we want to welcome primary care dietitian Ronnie Armstrong from the James H. Quillen VA Medical Center to daytime for a conversation on the difficult topic of eating disorders. Good morning.
Good morning.
Let's just talk about the very simplest question. What are eating disorders?
It's a great question. So eating disorders vary. So they are a mental and physical illness. They are severe. And somebody who has an eating disorder may appear completely healthy despite battling an ongoing and severe illness.
Who is affected?
Pretty much everybody is affected. Either you know someone who is currently suffering or has suffered, or you yourself has suffered as well. Now, statistically, about 9% of the U.S. population experiences an eating disorder at some point in their lifetime. With veterans, it's actually 16% of female and 9% of male veterans and active duty service members experience eating disorders.
So the number's just a bit higher for veterans.
Yeah.
Let's talk about, when we talk about what are the health consequences? We're talking about physical and mental health consequences.
Yes. So there's lots of different systems that are affected by eating disorders. Our endocrine, neurological, gastrointestinal, cardiovascular systems, they're all affected. And in some extreme cases, eating disorders can even result in death.
Talk to me, you work with the VA?
Yes.
What is the VA doing to help veterans with eating disorders?
So we have a lot of different resources. We have a whole team of mental health professionals and dietitians that can help address eating disorders or disordered eating before they become eating disorders.
What should you look for? I mean, you say that some of the symptoms are non-existent. You can't see them. What should you be looking for in friends and neighbors and people that you love? What should you be looking for as far as signs are concerned?
Yes, so there are lots of common warning signs. There's food withdrawals, social withdrawing, especially around food-centered events, preoccupation with weight, size, and appearance, and lots of other, avoiding food and situations like that as well.
Are there pre-existing conditions that kind of lead people into eating disorders?
So there's no one real cause for eating disorders. It's a combination of genetic, biological, environmental, and social factors. Now, biological could be a family history of eating disorders or a personal history of frequent dieting. Psychological factors could be, perfectionism or trying to achieve the perfect body, and social factors could include trauma, bullying, weight stigma, societal norms around food, weight, and food rituals.
Say that someone sees some of these indicators and they want to get help. How do they go about getting the help for their friend, for their loved one?
Yes, so it is an issue that should be addressed with a primary care provider, and if they are a veteran and receive their care at the VA, please talk to the primary care provider about that. There are lots of different resources if you want to look more into them online. The VA has their own resources, but eatingdisorders.org and ANAD.org are also some great resources.
And that's for people. But if someone, a veteran or whomever, thinks they may have it, they may not know, but they want the help. They're seeking help.
Yes.
Same way. Go find the help. Start with your primary care.
Yes, yeah. And then they can also request to speak to the dietitian if they feel like they're having unhealthy eating behaviors, restricting food unnecessarily. All those behaviors can lead to eating disorders. So we want to make sure we catch them before they become serious.
All right. Ronnie Jo, thanks so much for stopping by.
Thank you so much for
having me.
Great
information.
Thank you.
Great information. Helping with eating disorders. You can call that number right there, an outpatient nutrition hotline there. Go to va.gov. Go to any of those websites that you see right there for your help to get started.